Did you know that over 37% of veterans, like you and myself, suffer from some form of high blood pressure? That means that more than one in every three veterans that we come across has hypertension. That's extremely alarming. And because of that, I'm making this video. What's up, veterans? VA Disability Guy back again with another video that you don't want to miss, because today we're talking about hypertension. Specifically, we're going to talk about what hypertension is, what causes hypertension, symptoms of it, and as always, what the VA is looking for when giving you a rating of up to 60% for hypertension. But before we get to the content of today, if you're new to the channel, go ahead and hit the subscribe button. You won't regret it. And for those of you that want to be notified whenever I upload a video, hit that notification bell also. If you like the content that I provide and you find it informative, leave a like on the video. That lets the YouTube algorithm know that these videos are important, and it'll push it out to more veterans like yourself. And before I forget, at the end of the video, I'm going to give you all a VA disability that I think about 60+% of people that have that disability also have hypertension. So if you're interested in that, stay tuned to the end of the video for that special information. Now let's get to today's video. All right, y'all. So what is pulmonary hypertension? Basically, it's a type of high blood pressure. It affects the arteries in the lungs and the right side of your heart. In one form of pulmonary hypertension, called pulmonary arterial hypertension, known as PAH, blood vessels in the lungs are narrowed, blocked, or completely destroyed. The damage slows blood flow through the lungs. Blood pressure in the lung arteries goes up. The heart must work harder to pump blood through the lungs, and the extra effort eventually causes the heart muscle to become weak and fail. In some people, pulmonary hypertension slowly gets worse and can be life-threatening. One thing to note, there is no cure for pulmonary hypertension. So this is a condition that will basically last forever, all right? Treatments are available to help you feel better, live longer, and improve your quality of life. So if you're diagnosed with this, odds are you'll have your rating pretty much forever because there's no cure for it. All right, so when it comes to what causes high blood pressure, it usually develops over time, and it can happen because of unhealthy lifestyle choices, such as not getting enough regular physical activity. Certain health conditions such as diabetes and having obesity can also increase the risk for developing high blood pressure. And when it comes to the symptoms of high blood pressure, hypertension, those are severe headaches, vision problems, difficulty breathing, pounding in your chest, neck, or ears, fatigue, chest pain, irregular heartbeat, and blood in your urine. And veterans specifically tend to experience dizziness, nervousness, sweating, trouble sleeping, facial flushing, and blood spots in their eyes. And hypertension is a VA disability, and it can get you a rating of 10%, 20, 40, or even 60%, depending upon the frequency, severity, and duration of your symptoms. However, in order to be eligible for VA ratings, when it comes to hypertension, you must experience the 3 criteria that you see right here. That's going to be medical diagnosis. So your doctor has to diagnose you with this actual issue. It can't just be you having the symptoms and thinking you have it and just filing your claim. You have to always have a diagnosis. And in this case, a diagnosis of hypertension. Also, your hypertension either has to have been caused or made worse by your active duty military service. And 3, you have to have persistent and recurring symptoms of hypertension. Now, when it comes to understanding your rating or the rating that you could get for hypertension, it comes down to these two things, either systolic pressure or diastolic pressure. And I may be pronouncing them wrong, but systolic pressure is basically when your heart is beating. All right. And diastolic pressure is when your heart is either at rest or in between an actual heartbeat. So for a 10% rating, you're at rest or in between pressure must be between 100 and 109, or your systolic pressure, meaning your active or beating heart pressure or heart rate, must be 160 to 199. For 20%, diastolic 110 to 119, or systolic 200 or higher. For 40%, diastolic pressure is 120 to 129, meaning your resting heartbeat or heart rate is between 120 and 129. And for 60%, diastolic is 130 or higher. Notice for 40 and 60%, they're not even focusing on your systolic pressure anymore, meaning they're only focused on how your pressure is operating at rest. All right, so for those of you all who stuck around for the entirety of this video, this is a special treat for you. Look, hypertension can be secondary to sleep apnea. And whether you know it or not, sleep apnea is a very frequently claimed disability amongst veterans. And what's even more interesting is the fact that the most prevalent cause of secondary hypertension, as you can see, is obstructive sleep apnea, and that's at 64%. That is a big deal. So for those of you all that suffer from both sleep apnea and hypertension, or if you suffer from sleep apnea and you think you have hypertension, odds are pretty high and they may be in your favor. All right, ladies and gentlemen, thanks for watching. And as always, if you found this content of use to you, leave a like on the video. And if you're not subscribed to the channel, subscribe, hit the notification bell. That way, whenever I upload, you'll be notified. And for those of you that stuck around for the information I gave about obstructive sleep apnea being a condition that leads to hypertension, you might want to check out this video I have above about sleep apnea. And as always, take care of yourself, take care of those around you, and I'll catch you all in the next video. Peace.